Okay, so can you please start yourself?
Okay. Hello and a warm good evening. I, Solu Gautam, welcome you all to this 100th session of Mero Eye Talks webinar. Today, as a speaker, we have with us Dr. Teresita Reyes Yambot, and she will be talking on topic innovative approach in the optometric management of red and green color deficiency cases. Before she begins, I would like to give her general introduction. Dr. Tess is an OD, MAED, and MSO. She is also the fellow of Philippine Academy of Optometry and Civitan International Research Center. She is an optometrist, an educator, a scholar, and a researcher. She has her specialization in neuroscience, developmental and intellectual disabilities. She is also associated with Australasian College of Behavioral Optometry and College of Syntonic Optometry as an international associate member, whereas with OEP as a clinical associate. She is also the national president 2000 of Integrated Philippine Association of Optometrists. I welcome you, Dr. Tess, on behalf of Mero Eye Foundation and all our participants.
A pleasant good evening to all our participants. It's an honor to be with you tonight. And my topic for tonight is about scientific clinical study on color blindness in the Philippines. And my title is The Innovative Approach in the Optometric Management of Red and Green Color Deficiency Cases. Our eyes are sensitive to a very narrow band of frequency within the enormous range of frequency of the electromagnetic spectrum. This narrow band of frequency is referred to as the visible light spectrum. And visible light, which is detectable by the human eye, consists of wavelengths ranging from approximately 780 nanometers down to 390 nanometers. And the long wavelength end of the spectrum corresponds to the light that is perceived by human to be red and the short wavelength to be violet. Other colors within the spectrum includes orange, yellow, green, and blue. Seeing color is a psychological and a physiological response to light waves of specific frequency or set of frequencies impinging upon the eye. And this light that enters the eye through the pupil ultimately strikes the inside surface of the eye known as the retina. And the retina is lined with a variety of light-sensitive cells known as rods and cones. And when light of a given wavelength enters the eye and strikes the cones, specifically blue, red, and green of the retina, a chemical reaction is activated that results in the electrical impulse being sent along nerves to the brain that interprets signal received. The cone sensitivity helps us to better understand our response to the light that is incident upon the retina. Both physiological and psychological processing occur when a white light is incident upon the retina. There are photochemical reactions of the cones to produce electrical impulses that are sent along the visual pathway to the brain, and then the brain detects them. A light hitting the eyes and the brain responds. It is white because it recognizes that each of the three kinds of cones were activated into sending the electrical messages along the brain. So this is the cone, and we have here the rods, no? So when we have a spotlight that is yellow in color, this is a combination of the stimulation of the red and the green cones. So, of course, we have to consider the genetic factors, no? So, if the father is affected and the mother is not affected, the sons will not be affected. but the daughters will become couriers, no? And then, if both parents are colorblind, the father and the mother, we expect the son and the daughters to be colorblind too. And then we have the X-linked recession, wherein the mother is a courier, and you will see that here, the son, the daughter, not affected, and here, the daughter is a carrier, and one son is affected. I guess you have to review the types of color blindness. If it is trichromacy, we have normal color vision using all types of light. We have the three cones, red, green, blue, no, efficiently working. When we have anomalous trichromacy, then people with faulty trichromatic vision, no, wherein the red or the green or the blue is affected. And then we have people with reduced blue sensitivity. In my practice, I have not yet encountered a patient with blue-yellow deficiency. Most of my cases are red and green deficiency. The different anomalous condition are protanomaly and deuteronomy and trianomaly. So these are the different types of color vision. So this is a trichromacy condition. We have deuteranopia, we have protanopia, and we have tritanopia. So this is how they see. And of course, you're very familiar with protanopia. So these are the how they see the various color. The shade differs. I will not elaborate on this because I would like to elaborate on the clinical procedures. And then those with green weakness, we call them deuteranopia. No? So this is how they see the various colors. The green becomes gray, the bright green with yellow, pale pink with light gray, mid-red with mid-brown. So colors changes. No? While blue deficiencies may see blue as gray, dark purple, or black, mid-green with blues, and orange with red. And the images show how the beautiful colors of the pigments are lost to people suffering with each type of dichromatic vision. So if the patient only sees shades of gray, then the condition is monochromacy. So these are the different types of blindness. So to summarize, we have normal vision, can see all the spectral colors, the visible spectrum. And then we have protanopia, red deficiency, deuteranopia, it's a green, and then trita, it's a blue deficiency. So based on our statistics, 8% of men and 0.5% of women have color vision deficiency. So for Escadavian, they said around 10 to 11%. No? So men are usually affected with color blindness. Most studies show that there is no treatment for color blindness. So in our practice, once we have determined through the use of the Ishihara chart or the pseudo-isochromatic chart that the person is a color blind, then we just simply tell them, I'm sorry, there's nothing we can do. Because that's what we know. There's no treatment for color blindness except you can enhance their vision by using magenta filters, or there are some advertisement if you use echroma, you see better the various colors. So, and the problem with our patient with color blindness, they want they want to pass a test in the company that they are applying. They want, usually the physician would like them not to wear any filters during color testing, or any contact lenses. The physician will just remove all of that. So the various scientific clinical investigation result gave evidences of breakthroughs in the treatment of patients with red and green deficiency. So this is my clinical protocol for patients with red and green deficiency. So we have to consider that a person with normal vision can see the apple red or if it is green. But someone with red and green color blindness will see it like this, no? The apple red becomes a light greenish, then this one becomes yellowish, and the same if they look at clothing, no? Yung hat, t-shirts, or even shoes. Sometimes you just wonder why the clothes they wear does not match, no? They sometimes tell you, I'm wearing brown when the pants is green. So that's the problem of people with red and green deficiency. So color blindness or color vision deficiency includes a wide range of causes and conditions. It's actually quite complex. Usually when people talk about color blindness, they are referring to the most common form of red and green color blindness, which are genetic conditions caused by excessive gene on the X chromosomes, but there are other types as well. So red and green color blindness can be broken into two types. We have protanopia and protanomalus. And if it is green, we have iota, no? Which is a disorder of the second type of retinal cone, also called the end cones. Okay. So the first step I do is I look at the fundus by fundoscopy or ophthalmoscopy. And of the 10 cases I subjected in the clinical trial, all of them, no, the fundus are pale. So I have to ask them to eat food rich in vitamin A with complete nutritional supplication. So second is I test the patient if he can see the basic spectral color. Usually, what we do, we present immediately the Ishihara chart without testing whether they can see the basic spectral color. It is important to introduce the basic spectral color because sometimes the patient can see the spectral color clearly, but when you present the Ishihara chart, they have some problems with different shades of red or different shades of green, but they can see the basic spectral color. So in my clinical protocol, it is very important for you to test the color perceptual skills using the basic spectral colors, no? So we have additive colors, which is the mixing of color lights, and this will be the result if you mix green and red, yellow, and then if you mix green and blue, and then yeah, becomes pink or light, no? Bluish green. Okay, then subtractive if you use painting. So you have to test whether the patient can do all of this. Now, when you have your Ishihara testing or the pseudoisochromatic chart, if you're using that, this is what I do. I have a red and green filter. First, I ask the patient to copy the numbers. I ask them to copy the numbers because I want a research that is evidence-based. So once he copies the letter, let's say I use a chart, just the small one for startup, around 14 slides, no? So with the 14 slides, I ask him to copy the numbers and trace whenever there is a tracing activity. And then let's say the score is 1 out of the 14. So let's say he can only see 12. Now the question is, he's colorblind, but what type of color blindness? Now what I do, I ask the patient to wear a red and green filter. And then I ask him again to copy the letters. To copy the letters. And in most of the cases, wearing this, they will be able to see the numbers. Okay. So remember this. The difference between the two is simply to what extent the L cone is affected. So if we have protanopia, the definition protanopia, the L cone is missing. So it's absent. So if it is protanomaly, the L cone is present but impaired. So how do I know? When I ask the patient to wear the red and green filter, and then I ask him to copy the slides, the chart from 1 to 14, and he gets a perfect score, that means you can manage that patient. You will be able to enhance his color perception without any aid in the future. But if, let's say, you place the red and green filter and then you ask him to trace and there's a lot of errors, no? Let's say there's only a few improvement and lots of error, that means the red cone, the L cone is missing. So that is my criteria. I select those cases who can improve when I put the red and green filter. And then after that, let's say the red filter is here and then the green filter is here. I test. Can you see the numbers clearer with your right, or do you see it clearer with your left? If the patient tells me, I can see all with the red, so that means the condition improves with a lens that has greater transmission of red. So he has protonomaly, which is weakness, no, of the L cone due to impairment. Okay. Now, what is the difference between deuteranopia and deuteranomaly? No? So here, it's a green blind. And then if it is deuteranopia, the green cone is missing. When it is deuteranomaly, there is green weakness. So the green sensitive cones are not missing. No? So if you ask the patient to wear the green and the red, and then he says, I see better with the green, so that means the green lens has greater transmission of the green light. And so it enhances, that's why the patient can now see the Ishihara chart. By the way, if I have determined that he can see better with the red, I remove this and I use syntonic filters. And it just works wonderful because with the syntonic filter, they usually get 100%. So remember, we are categorizing the patient, selecting whether the condition is a protanopia case or a protanomaly case. No? Kasi if it is protanopia, the cones are missing. So what will you enhance? But if it is a protanomalous, the cones are present but impaired. So you can do something to enhance the cones because the cones are present. So the same true with deuteranopia, no? And then, what is my treatment for polio for patient with red and green deficiency? So, nutrition is my number one because the fundus is pale. I have to tell the patient, you have to to eat, no, food rich in vitamin A, and you should eat the proper nutrition with all the needed vitamins, nutrients, minerals you need daily. So that's part of it. And then I have a student who is an optometrist and who became a pharmacist who set up a pharmaceutical manufacturing company. I asked her, can you formulate a vitamin A capsule that will enhance the function of the cones and the rods, as well as enhance the brain function, no? So she developed this, and then the omega is good for the brain, cerebral cortex, the skin, and the retina. So I ask all my patients to drink this on a regular basis. So I use phototherapy. I attended the College of Syntonic Optometry, 101 course on phototherapy, and I have discovered what filter works best for patient with red and green deficiencies. And then what do I do? Our common problem with our optometrists is that when we present the chart, we ask them, what is the number? Then we go to the other slides and ask, what is the number? If there is error in the number, no, all we do is we close the book and then put it and tell to the patient, I'm sorry, there's nothing I can do in your case. And that's it. But if you just have sympathy and passion for that patient who wants to work, you have to do something, no? So I did some experiment, and then what I did is like this. I asked the patient to copy the figures. So I present chart, the patient copies. No, the patient copies. So I asked them also, can you sequence the shape? So I teach them, you know what you are connecting are different shades of green and different shades of red. And then I usually ask them, do you see this blue? Can you arrange it from lightest to darkest? And then do you see this green color? Can you arrange it from, let's say, green going to the blue side? So now the patient understands. That's why if you notice in my previous slide, I was emphasizing seeing as physiological and psychological. No, okay. So would you be surprised doing this? In the first time the patient went to me, you can see the signs of red and green deficiency. But after the therapy of teaching the patient how to sequence and figure drawing, after several days, perfect na niya yung Farnsworth test, okay? So, I asked them, after doing the sequencing of color, they now know that they are combining red of various shades and green of various shades. So there is physiological and psychological process happening sa patient, no? So I asked them to trace. Now he can trace. You see, now he can trace. Okay. So, as mandated, we have to take the central visual field. And 100% of the cases have contracted red and green visual field. Most of them. And this will be your basis to know whether something is happening with your neurovision therapy. We're using lights. So we stimulate the cones, we stimulate the brain. And so after the series of therapy, we discovered that there will be expansion of the blue field, the green field, and then the red field. So we have to test the patient at least every 2 weeks just to determine the expansion of the visual field. Okay, so here I have an intern, an optometry student. He was with the 10 cases I have, and he was so disappointed because he was with me for 3 months, and then he has not yet completed the testing 100% of it because yeah, there's problem somewhere, but he is protanomalous, meaning to say the red cone is there but it's impaired. Here he is testifying that a day before he left to go back home, he was able to do the Ishihara test with a perfect score. And then he was challenged to do the Farnsworth. He got it also 100%. And I added additional therapy for him. And it's so amazing. The moment I touched the point, he was telling me, Mom, can you hold it? The colors are just uh, enhancing. Now I can see the colors. I can see now the numbers. So this is another discovery that we had. But we did a lot of experiments. Now, because we are in the pandemic season, especially now in the Philippines, we are locked down. We're not allowed to go out because when they opened up last time in May, the incidence increased, no? Double. Now I think it's even rising before 3,000, 4,000. The figure are indeed alarming, no? So we have to do online, virtual, or remote neurovision therapy. So I go on my online consultation and he goes in his online patient waiting room and I do instructions on what to do, no? And so I asked him, I do online. I give him a chart online and then I asked him to trace. And he was able to trace all of them perfectly. So he got 100%. So the next time, our trainees, optometrist trainees, our residents are asking, how do you do that? Can you demonstrate? So I asked them, can everybody go to Zoom? And I will ask the patient to go to the Zoom instead in my consultation room so that everybody sees how the patient does it. So the patient traces the number, writes the number, and he does it 12 slides. And after doing it correctly, he gets a score 100%. This is only after 3 weeks of the nutritional supplementation, the light stimulation, and the tracing of all the necessary colors that were presented to him. Now he is already using the 34 slides. And yesterday, we were amazed because he got only 5 incorrect answers. But today he texted me again and told me Doc, I have already 100% after trying going back to that 5 incorrect numbers. So what is our future plan for this clinical investigation? In the Philippines, I started doing it actually in 2010. But with the new clinical protocol I started in 2017 and saw the success in 2020, I wish this clinical investigation will be in a global setting by 2020 to 2025. And I just wish the clinical and treatment protocols adopted by optometrists nationwide. So it's a very simple, innovative approach in the optometric management of red and green deficiency. So we have organized our research team. The investigation is still ongoing. I have included our optometrist, who is a pharmacist, and included Doc Gina. We have Doc Maurice Paredes as my co-investigator, and all our boards, no, being part of the team, and our clinical associate consultant doing these clinical trials. And we hope with many optometrists doing the adapting the clinical protocol as well as the treatment plan, we will have a lot of people with red and green deficiency be able to restore their confidence and be able to pass the medical or health exam being conducted by their companies. That's all for now. Thank you so much. And I would like to acknowledge the College of Syntonic Optometry. I use the HRR chart by colormax.org, and then the Colorblind Essential by Colblinder. And my reference for the type of color blindness came from the National Eye Institute. Thank you so much and have a pleasant good day.
Okay, thank you so much, Dr. Tess, for such a wonderful session. Well, now it's time for the discussion session to begin. Are you ready to take the questions, Doctor?
Oh, yes.
Okay, let me check out the questions that our attendees might have raised. Okay, we have our first question by Mr. Azad Saha. His question goes as, in some cases, a patient can see the color of objects normally, but cannot read the Ishihara plays correctly. Do we label them as colorblind?
In my case, I told you earlier, prior to testing with the HRR chart, I want you to test whether the patient can see the basic spectral color, that is red, orange, yellow, green, blue, indigo. Usually it is best if you have a matching color and then you ask the patient to match. Because we have cases with red and green deficiency, but can see the spectral color, and I have justified them their case with their physician that the patient in his workplace that not need a uh, very detailed for the red, various shades, or for the green, various shades. And when he saw that he was able to see the basic, then he was admitted for the job. Okay, so yeah, you have to test whether the cones are present or the cones are missing. I mentioned about the L cone and the M cone, and we have the S cone. And I also emphasize that if the cone is missing, I will just go back to the slides. If the cone is missing, then it's very difficult to do neurovision. So what we are treating are those red and green deficiency wherein the red cone is present but impaired, or the green cones are present but impaired. But if it is absent, then there's nothing you can do. It's absent. So it's very important to categorize your case. Yeah. So other questions?
Yeah, we have our another question. When there is no treatment available for color blindness, why do we do colorblind screening in schools or in communities?
Why do you do color vision testing in schools and communities?
Yeah, doctor.
Every person are exposed to various shades of colors. And so it is very important for us optometrists to do screening for color perception aside from visual acuity testing. We usually recommend when we have comprehensive eye exam, we have to test the visual acuity, the ability to see colors, color perceptual skills, binocular vision fusion, stereopsis, like that. So I think it should be mandated that color perceptual skills testing should be done to every school children, workers, or community people. You have to add that in your practice. So other questions?
Yeah, doctor, we have another question. Is there any genetic testing available to diagnose early the carrier of colorblind genes so that marriage can be arranged judicially so that child born may not be affected?
Uh, can you repeat again the question? That's so clear to me. I will try to read in the chat group. So what is the early symptoms of color blindness? Doc, can congenital color vision defects? Uh,
Actually, doctor, there is a one question. May I read for you?
yes, sure.
Okay, please, doctor. So, what are the earliest symptoms for the color blindness? What you see actually the color vision defective patients' early symptoms.
In most cases, usually parents do not know that their child has problem with color perception. I usually refer that as a color perception because there is no yet diagnosis whether there is color blindness. And we have to consider too that there is a total color blindness, no, we call as monochromacy, wherein the patient only sees shades of gray, no? But I have never encountered in my case conditions like that. So usually parents do not know that the child has problems seeing colors. That's why it is very important. We cannot even say if it is congenital or if it is inherited, because sometimes parents do not know that they have inherited uh, the condition from their ancestors, from their parents, no? Until the time the child undergoes testing. And unfortunately, because optometrists are not doing the color perception test regularly as part of their routine, these people may grow at the age of 21. When they apply for job, that's the only time the person realizes, oh, I'm colorblind. And then uh, they will be arguing why I can see the color green, I can see the color red, until you explain to them when we label you as red and green deficiency, it means that some of the various shades of red you cannot distinguish, or some of the various shades of green you cannot distinguish.
Oh,
So
well,
yeah,
well. Yes,
Did
thank
that
you so much,
answer
doctor.
the
Yes,
question?
yes, it's got it. Yes, we got it. So,
Yeah.
doctor, basically in Nepal, like we didn't have any regulation, or basically Nepal government do not allow to drive who had congenital color vision defect. What is
Yeah.
the scenario of your country? Is it the
The
same
same
or
true.
okay?
The same true. But for yeah, they have screening for color perception skills.
Okay.
They have. Then we have screening for drivers, and now most of the work place already mandated all to undergo the test. So it's too late that they realize when, if you just look at it, there are categories of red and green colored deficiency that can be treated by an optometrist. So let us not close our mind to the thinking based on what we have read in the book that there is no treatment for red and green. What we have in the book, there is no treatment for color blindness. We have
Yes.
now seen that for a certain cases of red and green, there is still hope it can be corrected. Because all the patients that I have, I ask a follow-up after a month, what happens? I usually call, King, how are you? Can you still see the colors? Yes, ma'am, I will try in school again, the Ishihara, Farnsworth, and the Farnsworth test. And he said, yeah, I can still see.
Okay.
Yeah.
Okay. Hope that answers. So we have another question. If the patient, you can also see in the screen, doctor. So if the patient's near vision is badly affected, can we perform the color vision test, or how much it will be reliable?
So actually, all your patients, you should perform color vision test. And then ask for professional fee for doing that because, yeah, it takes time. And then you have to come up with diagnosis, whether it's a protanopia, protanomalus, whether it's joteronopia, joteronomus, or whether it is a trita. Yeah, you have to come up with a diagnosis.
Okay, thank you so much, doctor. I found
Yeah,
one interesting question from the Cure for Your Eyes. Thank you so much for your question, doctor. So
yeah.
he is asking for which filter is used for the syntonic. As you
It
asked, yeah,
differs. It differs.
yeah, yeah.
Yeah, I saw four combinations.
Okay, okay.
Yeah.
So can you please explain behind the theory of it, doctor?
The theory behind
Behind it, like why this filter is used?
why?
Why this? Yes, why this filter is used? And if you mention the filters that used for the syntonic therapy to treat the color vision. So why this filter is used?
Why this filter? The
Yes, doctor.
syntonic.
Yes, yes.
It's like this. There is no specific filter recommended. When I
Mm-hmm.
took up phototherapy with the college, they tell us that this combination is for sensory stimulation and this one is for motor stimulation.
Mm-hmm.
So we do trials, no?
Mm-hmm.
I have seen that the two combination, which is basic to all vision disorder, can be used by people with red and green deficiencies.
Mm-hmm.
So if I try, how many of you took up phototherapy under the college? Did they,
Actually, doctor,
or
in my experience, I don't see any specific person that you are anybody are using this practice on our clinical practice. So I didn't have any experience, but I don't know. Some of the attendees might have experience. So if
yeah,
anybody want to share this experience, you can also comment on the section.
yeah, Dr. Fox is one of my mentor. I heard
Yeah.
that he has been your mentor here too. So
Yeah.
it's a combination of red and green too. Yeah.
Mhm.
But sometimes there are cases that respond quickly. Let's say
Mhm.
within a week or 2 weeks, they can see already. But there are cases that does not respond that fast. So I use combinations. Even
Mhm.
with King, our intern, yeah,
Mhm.
I use the usual combination, but it takes time. So I tried another combination. And when I was able to determine the good combination for him, he told me, Mom, now I can see the numbers, I can see the colors. It was
Mhm.
like just a click. And then he says, hold, I can see it. And now he can see the EGR chart with a score of 100%, which
Okay.
it's sustained.
Okay.
So you can do trials, and I guess you should attend the course of. They have it October 11 and 12. So those
Mhm.
interested, Syntonic will be happy with me because I'm
Mhm.
promoting their conference. Yeah, it's a new it's neuroplasticity. It's
Yeah.
wonderful. Yeah.
Yes, doctor. So we are also interesting on this asymptotic vision therapy. I guess most of the attendees have
You ask
also
Dr.
interest.
Robert Fox to do the lecture because
Yeah. Yes.
qualification. Yeah,
Yes.
he's
He's
one of
also.
yeah.
Yes, doctor. Actually,
Mhm.
he's. We are not conducting the free class for that. We are connecting with the fellowship program, and he is going to talk about the syntonic as well in the fellowship program. Yeah.
Yeah, it's wonderful. I had training 2017. That's why
Yeah.
I wrote there that this is my clinical. I have my clinical protocol for treatment of color blindness before, but
Mm-hmm.
when I underwent training in 2017, I have to change. We have to change clinical protocols now every now and then because sometimes the old clinical protocol we use works not that fast, and with the new technology, treatment becomes much better. Yeah. I have children with autism, ADHD, hyperactive. Do you know, if you know the clinical protocol and the treatment, 5 minutes you can calm the child with the use of synthetic
Okay.
colors, with the right colors. Yeah.
Yeah, that's great, doctor.
Before I
So.
don't, before I don't believe that. Only when I have encountered a case that I went after attending a conference with the College of Syntonic Optometry. Yeah, in 2017. That was June.
Yes,
Yeah.
doctor.
So
Yeah.
at that,
So yes,
mhm.
doctor. Thank you so much, doctor, for your information. And I also like to add the one information here. The conference that uh, going to held by American Association of, I guess it's from AAO. They are also going to do the conference. So I'd like to request all the attendees, if you are interested to join the free conferences, so kindly visit this website and you can also enroll yourself. And I saw the one other question. So here's this question from the Azad. So let me copy and paste on the Zoom. He's asking for Dr. Uh, without knowing the status of con, how can we document in the patient color vision, color blind or normal?
Now it's like this, no? I have a nephew who is a retinal specialist, an ophthalmologist. And with the new set of subjects that we will have clinical investigation, improving our past clinical protocol and treatment plan, I want to take the documentation of the condition of the retina with OCT, so we can see uh, are the cones present, or is it, you can see there it's thin or there's some structural defects. And then I would like to see whether the vitamins that we give him and the light stimulation, what changes takes place. That's why are categorizing this as a scientific research, because the investigation will, yeah, need not only the retinal structure but also what happens to the brain. And it will be wonderful if we can present this to our Civitan International Research Center at the University of Alabama, because this is the renowned Neuroscience and Developmental Intellectual Disability Center, Research Center, where I have been. Yeah. And actually, they were the one who encouraged me to go into scientific research. Yeah. So this is something to look into. And actually, I'm sharing this for practitioner to try the clinical protocol so that we can have a lot of patient workers who are suffering from red and green deficiency that can still be treated so they can have better work performance.
Okay, thank you so much, Doctor, for your answers. I guess we have answered almost all the questions till now. Considering the time limits, here I announce the closure of the discussion session. And I would like to thank all the attendees for coming up with the questions and making the discussion session more interactive. And also, I would again like to express my immense gratitude towards our presenter, Dr. Tess, for sharing our invaluable insights, and to all the attendees for their endurance. Also, I would like to thank all the direct and indirect helping hands for the iTalks program. Before wrap up, I request our today's presenter, Dr. Tess, to share her few words to our program.
So thank you so much for all the participants. Thank you.
Thank you so much, Doctor. It's our immense pleasure to have you with us today. Herewith, I announce the closure of today's webinar, hoping to see you all again tomorrow. Stay safe, stay connected. Thank you.